there, this is Debbie Van, founder and CEO of Pathways of Wellness, and you are joining us today on Wellness Wednesday, and we're so excited to have you. There, this is Debbie Van, and we are here with Tammy Dunn from Elementals Massage, and she's just going to give us some great information. So I'm just going to turn it over to Tammy and let her share with you.
Hi, thanks for having me today. I appreciate it. I am the owner, sole proprietor of Elementals Massage here in Donaldson, and my specialty is working with people with migraines, headaches, and people that have a sedentary office-style lifestyle, because there are studies that show that the body mechanics of office workers actually will encourage tension headaches and migraines.
Oh my gosh. So we're sitting all day long, so we're creating our own problem.
Exactly.
So what are some different types of headaches?
Well, there's two main types of headaches. You have a primary headache and you have a secondary headache. Secondary headaches are not really addressed in the massage industry that much because they are really symptoms of another situation, a more serious situation. It can be something as simple as having a headache with the flu, or something as serious as having strokes or brain tumors. So that being said, anytime you have a headache where you've never had headaches before, or if you've had headaches and that headache pattern has changed dramatically in a very short period of time, always need to see your doctor to talk about that. But if you suffer from tension style or migraine headaches, those are primary headaches. And that means that they are not a result of any other condition. The headache themselves are the condition. Most times, for the situation of migraines, there's not really a cause or cure that the medical industry is aware of. So management is the key. Same with tension headaches. They know what causes them, of course. They're tension headaches.
Stress.
They're caused by stress. Either they're physical or emotional causes, and those can be alleviated or treated and or alleviated to the most point with proper lifestyle changes.
Okay, good. Oh, that's awesome. What is your experience with headaches and migraines? Do you have a background?
I do.
Of that?
I do. I was actually diagnosed with migraines at the age of 13. At that time, I was having 3 to 5 headaches a week. So there were years of diagnosis process, different treatment processes, including, like I said, lifestyle changes, different types of medication. Some were taken after the onset of a migraine to stop it. Others were taken on a daily basis to try and alleviate them from coming on in the first place. I also, when I entered adulthood, I entered the corporate world and became a corporate desk dweller on the computer, 40 plus hours a week, sitting in a cubicle, literally connected to a telephone, 40 plus hours a week. I started developing tension style headaches, which were severe enough to be mistaken by myself and my doctor for migraines. But come to find out, it was 90% of those were coming from my lifestyle, meaning that I was sedentary, that I was in a fixed position most of the day, that I was staring at a computer screen. So eye strain, the emotional stress of being in a corporate environment, an unhealthy corporate environment, the body mechanics, all of that were feeding into those tension style headaches.
Oh, wow. So let's talk about that. Sitting all day, sitting at a computer, tell me all those muscles that get constricted and pulled and...
Well, surprisingly enough, sorry, I didn't mean to interrupt, but surprisingly enough, they're finding out, science is finding out that when your low back, when your sacrum, the base of your spine, and the hip joints, the SI joints, are sedentary, they become restricted. They actually have a little bit of natural movement because they're two bones meeting. So even though they're not an articulating joint, they're still a joint. There's soft tissue in there. And by being sedentary, either by sitting or standing in the same position all day, those joints kind of dry out a little bit. and they get irritated and inflamed, and that keeps the hip joints and the sacrum from moving independently and moving the way they should. This actually will feed all the way up the spine. So you start out with low back, and then suddenly you get a stiff neck within the next few days or few weeks, and then you start experiencing headaches that start at the base of the neck or in the shoulder and feed up on one side or the other of the head, the skull. And it's because the bones at the top of the spine are trying to overcompensate for the lack of motion at the bottom of the spine.
Oh, wow.
So by working with the spine as a whole, and working with working within the skeletal structure as it relates to the soft tissue, massage therapists can actually help alleviate a lot of that problem so that the headaches don't occur to begin with. Not to mention, a side benefit of getting massage on a regular basis, the emotional stress that it can control and alleviate will also take that emotional tension out of the equation for tension style headaches.
Right, right. And plus, I know, like, even in my practice, I teach people how to stretch.
Exactly.
And those kind of things. So that they're
Exactly.
at least getting up once an hour or something, getting out of that chair and
Yeah,
moving.
60 to 90 seconds once an hour just to undo what you're doing all day will just keep the body from assuming that you need it to be in that position 24/7. By moving it around a little bit, the soft tissue and the muscle memory goes, okay, that's right, we've got a full range of motion, we still need all that.
Right.
So, and it helps, of course, keep the joints lubricated, even the joints in the spinal cord or in the spinal column, keeps those lubricated so that there's less irritation when you do start to move at the end of the day.
Right, right. So what therapies have you found to be most successful in treating, helping with migraines and headaches, tension headaches?
Well, with tension headaches, craniosacral, and even something as simple as a basic Swedish massage. Getting that emotional tension, helping to relieve that, encouraging the body to relax, the mind to relax. Massage can help with all of that. It can also help alleviate tension in specific muscles. For instance, the group of muscles, you've got a huge group of muscles that start at the base of the skull and literally go all the way down to the tailbone. It's all one continuous mass of muscle. Using that, for example, not moving around during the day, sitting at a desk, leaning forward, reaching forward, all of that, it can stress the chest muscles, which will stress the shoulder muscles and the back muscles to compensate. So by working those muscles, physically working those muscles in a Swedish massage, relaxes that tension, lets them release, lets them lengthen back out where they should be so that the body is more balanced and it gets back to its optimum. That's what it wants to do. We just have to figure out how to help it do that after we live in it all day.
Right.
That's a really good option for tension style headaches. With migraines, it really depends on the type of migraine that you have. There are two major types. You have vasorestriction and vasodilation. Vasorestriction is exactly what it sounds like. The blood vessels in the brain and in the head are restricted, so you're not getting the blood flow that you need. Doesn't mean that it's cutting off the blood flow or that it's causing damage. It just means that things aren't working the way they should because this tissue is restricted.
Right.
Increasing therapies that increase that circulation, relax that tissue, open that up, that's going to help alleviate someone with a vasorestrictive headache. Heat, for instance, it encourages circulation to the area. So people with vasorestrictions know that if they put heat on their head or their neck, it'll help alleviate the symptoms. Same things with massage. Range of motion, movements in the head and neck, stretching, working that tissue and encouraging that circulation, that's going to help combat and maybe even stop in the process a vasorestrictive migraine. With vasodilation, it's exactly the opposite. Those vessels in the head are wide open. You're getting too much blood, too much oxygen, all of that. It's wide open and there's no control. Increasing circulation in that situation is only going to hinder that process. It's going to make it worse. In a lot of people, it will actually increase the pain. So adding heat to someone with a vasodilation migraine makes it worse. Ice, on the other hand, helps alleviate the symptoms. So in that situation, you would want to use modalities that are easier on the circulatory process. So, for instance, craniosacral, very light touch, 5 grams of pressure, works on releasing the flow of craniosacral fluid up and down the spinal cord, releasing the soft tissue, opening up that soft tissue restriction, getting all of that back where it should be, and balancing out the fluids between the brain and the spine. That's a big aspect. So in balancing out those fluids, you get the backup of fluid out of here, get it flowing back down through the spinal column where it can be reabsorbed through the body and redistributed the way it should be.
Right.
But again, it allows the client to be still on the table. It releases tension out of the muscles, releases that soft tissue without really increasing the circulation in the veins and the arteries. So that gives them a huge relief.
So craniosacral, Swedish massage, what else would be effective?
Active isolated stretching in some instances, especially with tension headaches.
Okay.
And with cluster migraines, where you're having multiple short-term headaches. Where with migraines, people want to be still. They need to be still. They need to be in dark. There's a lot of sensitivity to sound, motion, touch, light, smells. With cluster headaches, being still actually makes them worse.
Oh, wow.
So, and laying down makes them worse. So using a routine of active isolated stretching, keeping them moving, maybe even utilizing a chair massage. Utilizing those therapies as the person is sitting up. That will allow you to work through the headache, get the headache to stop while keeping your client as comfortable as possible.
Wow, okay. That's a cool thing about chair massage. I didn't know that.
Oh, yeah. What most people don't know about chair massage is you can actually do techniques with a full body chair massage. So you don't have to lay down.
Oh.
For a full body massage.
Nice. Anybody want to experience that? You better call Tammy.
I got skills, people. I got skills.
So obviously you do all of those modalities here?
Yes, yes. Basic Swedish, of course. Deeper pressure if necessary. Craniosacral therapy, I'm in the process of getting my certification. That should be done within the next few months. After all the education, I'm getting the testing and certification done. Some active isolated stretching, assisted stretching, even some myofascial routines and fascial stretching, which people also find beneficial with migraines. You don't have to move, and we're not pushing into the tissue, which some people find hard to bear, but it's more stretching, working shallow on the skin and stretching and getting that tissue to release that way.
Wow.
So
those are some great therapies.
Yep.
Okay, well, if you are in this area in Nashville, anywhere in the surrounding areas, I don't care, maybe you need to come 50 miles, I don't know. You got to come see Tammy.
Yes, please.
Thanks so much for joining us on Wellness Wednesday. We hope you enjoyed it, and we will see you next week.